Did you know over 500 million people live with diabetes worldwide, and many don't even know it? In this video, we'll explain diabetes in simple terms: what it is, its types, symptoms, effects, causes, whether it can be cured, and how food and exercise can help. Diabetes is when your body struggles to control blood sugar. Normally, insulin moves sugar from your blood into your cells for energy. With diabetes, either your body doesn't make enough insulin or it doesn't use it properly, so sugar builds up in the blood. There are 4 main types. Type 1, an autoimmune condition where the body destroys insulin-producing cells. Usually starts young, needs insulin injections. Type 2, the most common. The body resists insulin or doesn't make enough, often linked to lifestyle. Gestational diabetes happens during pregnancy, usually goes away but raises future risk. Prediabetes. Blood sugar is higher than normal but not yet diabetes. It's a warning sign. Common symptoms include excessive thirst, frequent urination, extreme fatigue, blurry vision, unexplained weight loss, slow healing wounds, and tingling in hands or feet. If you notice these, get tested. Uncontrolled diabetes affects almost every organ. The heart. Higher risk of heart disease and stroke. The eyes. Damage to blood vessels, risk of blindness. The kidneys, kidney disease and failure. The nerves, pain, tingling, numbness. The skin and wounds, infections that heal slowly. That's why managing it is so important. Type 1 is autoimmune, not caused by lifestyle. Type 2 is often linked to obesity, poor diet, lack of exercise, family history, and age. Gestational diabetes comes from hormonal changes in pregnancy. Even kids can now develop type 2 because of unhealthy lifestyles. Type 1 has no cure yet, but can be managed with insulin. Type 2 can't be permanently cured, but it can go into remission. With weight loss, healthy food, and regular exercise, some people reach normal blood sugar without medication. But it needs lifelong care.
Now let's look at the foods that research shows can actually help put type 2 diabetes into remission. The strongest evidence comes from major studies where substantial weight loss was achieved through very low-calorie, medically supervised diets. In those cases, nearly half of participants went into remission. But food choices matter just as much. Here are the categories to focus on. First, load your plate with non-starchy vegetables like spinach, broccoli, peppers, and cauliflower. They're high in fiber, very low in calories, and help blunt blood sugar spikes. Second, add legumes. Beans, lentils, and chickpeas. They provide slow-digesting carbs, fiber, and plant protein, all of which improve glucose control. Third, choose whole grains, such as oats, barley, and brown rice. These digest more slowly and prevent sharp rises in blood sugar. Fourth, include lean proteins like fish, chicken, eggs, tofu, and tempeh. Protein preserves muscle during weight loss and keeps you full longer. Fifth, use healthy fats from olive oil, nuts, seeds, and avocados. These support heart health and satiety without raising blood sugar. Sixth, aim for fatty fish, salmon, sardines, or mackerel. Their omega-3s reduce heart disease risk, which is higher in people with diabetes. Seventh, choose low glycemic fruits like berries, apples, and pears. Always whole fruit, not juice. And finally, fermented foods such as unsweetened yogurt, kefir, or kimchi may help with gut health and insulin sensitivity. On the flip side, cut back on sugar-sweetened drinks, juices, processed snacks, white bread, pastries, and frequent fried fast foods. These make reversal far harder. The bottom line, no single food is magic. But a plate built around vegetables, legumes, whole grains, lean protein, healthy fats, and the right fruits, combined with weight loss, is the proven pathway toward reversing type 2 diabetes.
Exercise helps the body use insulin better. Aim for 30 minutes of walking, cycling, or jogging most days. Strength training 2 to 3 times a week. Add yoga or stretching for stress relief. Also, sleep 7-8 hours. Manage stress with deep breathing or meditation, and keep up with regular checkups. Diabetes doesn't mean life stops. With healthy food, exercise, monitoring, and support, millions live full, active lives. Knowledge and action are your strongest tools. So, this video gave you clarity. Share it with someone you care about, and don't forget to subscribe for more health guides.